Today we will be seeing about management of discolored teeth through bleaching. What is bleaching? Bleaching may be defined as the lightening of the color of tooth through application of a chemical agent to oxidize the organic pigmentation in the teeth. So the goal of bleaching is the restoration of normal tooth color. There are various bleaching materials used. It may be carbamide peroxide or hydrogen peroxide or sodium perborate or calcium peroxide. Coming to hydrogen peroxide, it is generally used in dentistry as a whitening agent at a concentration of 5 to 35%. It has very low molecular weight and because of that it can penetrate dentin easily. It is a colorless, odorless liquid and stored in light-proof amber bottles. It is unstable and kept away from heat. Care should be taken while handling ischemic effect. Ischemic effect on skin and mucous membrane can cause chemical burns. It is used also in walking bleaching technique. Usually in home bleaching, 3 to 7.5% is used. Coming to sodium perborate, it is stable white powder. Three types of sodium perborate are available. That is sodium perborate monohydrate, sodium perborate trihydrate, and sodium perborate tetrahydrate. The powder is water soluble and it can decompose into sodium metaborate and hydrogen peroxide, releasing oxygen. When mixed with the paste with superoxide, paste decomposes into sodium metaborate, water, and oxygen. It is used in walking bleach technique. Coming to carbamide peroxide, it is also known as urea hydrogen peroxide. The concentration used is 3 to 45%. 10% carbamide peroxide, that is urea, ammonia, carbon dioxide, and 3.5% hydrogen peroxide is used. So carbamide peroxide divides into urea and hydrogen peroxide acts on the hydroxyl radical. So over-the-counter bleaching agents, it may include tray system, trayless system, chewing gums, toothpaste, bleaching stripes, and paint-on products. These products primarily work removing the external surface stains. Coming to the bleaching mechanism, when we take carbamide peroxide, it breaks down in the saliva into urea and hydrogen peroxide. The urea further divides into carbon dioxide and ammonia, and the carbon dioxide becomes carbonic acid in the saliva. The hydrogen peroxide acts, releases oxygen, and it breaks the free radicals. Coming to the classification, dental bleaching is classified into office bleaching and home bleaching. The office bleaching is also known as power bleaching, which is further classified into vital bleaching and non-vital bleaching. So, in-office bleaching techniques include power bleaching, thermocatalytic bleaching, and photothermocatalytic bleaching. Among the vital bleaching, the at-home technique includes night guards. So, among the non-vital bleaching technique, the in-office may include thermocatalytic bleaching technique. Coming to the home bleaching, it is also called as night guard bleaching. It is more commonly used technique. It is very easy to perform and less expensive. Uses a custom fit tray with 10% carbamide peroxide. The indications are superficial enamel discoloration, mild yellow discoloration, brown fluorosis discoloration, and age-related discoloration. Coming to the contraindication of home bleaching, in case of severe enamel loss or hypersensitive teeth or bruxism, or in case of presence of caries, and in case of defective coronal restoration, or in case of allergy to bleaching agents, we can't use carbamide peroxide. So the steps of tray fabrication for home bleaching technique are: take an impression and make a stone model, trim the model, place the stock out of resin and cure it, apply separating media, choose the tray sheet material. Nature of the material used for fabrication of bleaching tray is flexible, and the common tray material used is acetates. And cast the plastic in vacuum tray forming machine, and trim and polish the tray. Check the tray for correct fit, retention, and overextension. Demonstrate the amount of bleaching material to be placed to the patient. Coming to the treatment regimen, the preoperative photographs are very important. Patient might forget the original shade with which he came to the clinic. Patient should brush his or her teeth prior to application of the tray. The surface debris minimizes effective contact of bleaching agent. So they have to brush and only apply the bleaching agent. Place enough bleaching agent into the tray to cover the facial surface of the teeth. So this is the home bleach technique tray. The tray should be worn for a period of 4 hours for every session. Reduce the time period if sensitivity is experienced. If sensitivity is not an issue, patient can repeat the bleaching session for second time in the same day. Remove the tray from the second molar in a peeling action. So we see how the tray is removed in the picture. Rinse off the bleaching agent from the surface of the teeth. Tray should be gently brushed to remove the bleaching agents. Number of days required to achieve desired results is chiefly dependent on the original extent of tooth discoloration, duration of bleaching in a day, and the patient complaints. Results can be seen as early as 1 week or 10 days, or it may take 6 to uh, 6 days to 4 weeks. Coming to the bleaching of vital teeth in dental office, it, coming to thermocatalytic process, the equipment needed are power bleaching material, tissue protector, activating source, protecting cloth and eyewear, and mechanical timer. Coming to the light sources, various light sources can be used. Conventional bleaching light or tungsten halogen curing light or xenon plasma light or argon and carbon dioxide lasers or diode laser lights can be used. Coming to the indication of thermocatalytic bleaching technique of in-office technique, mild fluorosis and tetracycline stains can be treated. Superficial stains can be treated. In order to match the existing color of the crown that is lighter than natural teeth, we can use thermocatalytic bleaching. Contraindications are extensive caries, hypersensitive teeth, exposed to root surface, severe discolorations, and extensive restoration. Coming to the procedure, evaluate the tooth color with a shade guide. Protect the gingival tissue with Ora base or Vaseline and isolate the teeth with a rubber dam. Place protective sunglasses over the patient and the operator's eyes. Clean the enamel surface with pumice and water. Remove the heat source and allow teeth to cool down for at least 5 minutes. Pumice is used on the teeth to remove residual exposed gel from the enamel surface. Irrigate thoroughly, dry the teeth, and gently polish them. Apply 30 to 35% hydrogen peroxide liquid or gel on the labial surface of the teeth using a cotton pellet. Apply heat with heating device or a light source. The temperature should be maintained between 125 degrees Celsius to 140 degrees Celsius, and the treatment time should not exceed 30 minutes even if the patient is not satisfactory. Apply neutral sodium fluoride gel 3 to 5 minutes, and any bonded restoration on bleaching surface and tea or coffee should be avoided for 2 weeks. So here we see bleaching agent is applied on the first picture and the curing is done on the second picture. Now we come to non-thermocatalytic bleaching. In this technique, heat source is not used. Commonly used solution for bleaching are superoxide ether, which is used in composition of 5 parts of hydrogen peroxide and 1 part of ether. McKin solution, where we use 5 parts of 5 parts of hydrogen peroxide, which is 30% concentration, and 5 parts of hydrochloric acid and 1 part of ether. Coming to the microabrasion technique, it is a procedure in which microscopic layer of enamel is simultaneously eroded and abraded with a special compound which usually contains 18% of hydrochloric acid, leaving a perfectly intact enamel surface behind. Here we see in the picture, first picture, isolation of the teeth with rubber band is done. Then Prima adhesive paste is mixed with 18% hydrochloric acid, and then the mixture is applied with a hand applicator for 5 to 10 minutes, and then it is washed intermittently with water, and then 0.2% sodium fluoride is applied on the tooth surface, and then the patient is advised not to rinse for 1 hour. So in the picture we see young patient with anesthetic fluorosis stains on the central incisors. Prima compound is applied with special rubber cup with fluted edges. The stain is removed from left central incisor after microabrasion, and it is further polished with prophylactic paste. and topical fluoride is applied over the treated teeth. Indications: developmental intrinsic stains and discolorations can be treated by this, and superficial surface enamel stains and opacities can be treated by this, and yellow brown stains can be treated, and multicolor stains like brown or gray or yellow stains can be treated, and superficial hypoplastic enamel can be treated, and the areas of enamel fluorosis can be treated. White patches and white spots can be treated. Decalcification lesions from the stasis of plaque and from orthodontic bands can be treated. Some irregular surface textures can be treated. Coming to the contraindication, age-related staining, we can't treat by this non-thermocatalytic method. Tetracycline staining are contraindicated, and the cases of deep enamel hypoplastic lesions are contraindicated. Some concentric areas of hypocalcification that extend to the dentine are contraindicated, and most amelogenesis imperfecta teeth are contraindicated. And most dentinogenesis lesions are also contraindicated. Caries lesions underlying the regions of decalcification are contraindicated. Areas of deep enamel and dentine stains are contraindicated. Coming to the bleaching of non-vital teeth, we will see about walking bleach technique at home. It involves use of chemical agents within the coronal portion of the endodontically treated tooth to remove tooth discoloration. Indications are discoloration of pulp chamber, dentine discoloration, discoloration not amenable to extracoronal bleaching. Contraindications are superficial enamel discoloration, defective enamel formation, severe dentine loss, presence of caries, and discolored composites. The steps include taking a radiograph to assess the quality of obturation, evaluating the quality and shade of the restoration if present. If restoration is defective, replace the restoration, evaluate tooth color with shade guide, isolate the tooth with rubber dam, re-establish the access cavity, remove the coronal gutta percha, expose the cavity and refine it. Seal the orifice of the root canal with at least 1 mm intracoronal barrier over the gutta percha to prevent percolation of the bleaching agent into the apical area. GAC, glass ionomer cement or resin modified glass ionomer cement or cavit or mineral trioxide aggregate or biodentine can be used as barrier material, of which MTA is superior than all. The level of the barrier material should be 1 mm incisal to the cemento-enamel junction. It is important to confine the bleaching agents to the crown of the tooth above the level of bone. And then mix sodium perborate powder with distilled water. In case of severe stains, 3% of hydrogen peroxide can be used. Carry the thick paste into the pulp chamber. Make sure the entire facial surface of pulp chamber is covered with the paste. Place the small cotton pellet slightly moistened with hydrogen peroxide over the bleaching paste. Seal the access cavity to a thickness of 3 mm using an adhesive material. The maximum bleaching effect is attained about 24 hours after the treatment. The patient should return in 3 to 7 days for evaluation of results. If too dark shade is used, additional bleaching is necessary. If shade is too light, the tooth should be permanently restored. Here we see the walking bleach technique, where in the intracoronally we are placing the barrier. We are placing the barrier above the gutta percha, which is endodontically treated in a endodontically treated teeth. We are placing barrier, and above that we are placing the intracoronal bleaching agent. Here we see three-dimensional obturation and the barrier placed, which can be MTA or GAC or resin modified GAC. Here MTA is the best barrier that can be used, and here we place the bleaching paste in intracoronally at the core region, and a layer of cavity is placed and covered, and the access cavity with cleaned pulp horns are treated with the bleaching agent. Coming to thermocatalytic bleaching, which is in-office technique, after the preparation of the tooth, as previously described, a loose material of a loose cotton is placed on the labial surface and another cotton is placed in the pulp chamber of the tooth to be bleached. The cotton mats are saturated with 30% hydrogen peroxide. The solution is activated by light and heat from a light source. The tooth is subjected to usually 5 to 6 minute exposures, and one replenishes the bleaching solution in frequent intervals. On completion of the bleaching, a pellet of cotton moisture with hydrogen peroxide or sodium perborate is sealed in the pulp chamber until the following appointment. Complications of intracoronal bleaching may include external root resorption, chemical burns, and also inhibition of resin polymerization. Thank you.